Hello everyone. This is Dr. Paul, and today I'm talking about one of the competencies that is human significant for the students problem for computation. H1.19 it says describe the mechanism of action, type, doses, side effects, indications, and contraindications of drug acting on listeners. So today I'll be focusing on some movement disorders and I'll be focusing on Alzheimer's disease. So if there is any issue or any queries that are right on the care about, and I'll get back to you for that particular point. And I hope I will be able to clear some doubts. So let's talk about the movement disorders. It could be either due to Parkinsonism, it could be either because of psychotic drugs, there could be an imbalance between the dopamine and acetylcholine, and many more factors that are here. So yeah, in my previous session, I talked about drugs for Parkinsonism disorder, where we talked about the deficiency of dopamine and what happens if there is excessive dopamine, polypeptide and so on, and 20% of the drugs which tend to cause uh, drug-induced Parkinsonism. So movement disorders could be of two types. One is dystonia, the other one is fixed. Dystonia is a twisting movement that is sustained as the peak of the movement is repeated pattern and often focused to prolonged abdominal positions, whereas fixed are yet individually recognizable intermittent movements or movement fragments that are suppressible and associated with an awareness of an urge to perform the movement. There are a few more movement disorders such as chorea and paralysmus. Chorea is involuntary, irregular, purposeless, non-rhythmic, abrupt, rapid, unsustained movements that can be partially suppressed or enlarged into semi-purposeful movement or voluntary movement. Whereas paralysmus is large amplitude movement of optimal parts cleaning or cleaning movements which occur in slow or overdose of physical. The treatment, there is no cure for Parkinson's disease. The goal of the treatment is to relieve symptoms, to prevent the complication, to provide support and assistance to the patient and significant others who might be not covered with it. So the various medications that could be used are antipsychotic drugs, drugs, tranquilizers, mood stabilizers, and botulinum toxin. The other disorder that we talk about is Alzheimer's disease and its treatment out there using the findings of what happens in can easily differentiate between two the normal section and the Alzheimer's section. We'll find out. So Alzheimer's disease is one of the most common types of dementia, and this is of about 50% of the dementia diagnosed affects around 5 million US adults, which is up to progressive to the the cause is uncertain and shows the pathogenesis, and majority of these cases are not identified. Incidence and prevalence is increasing exponentially with age. So there is a selective memory impairment, and this is one of the most potential and often the earliest treatment management of Alzheimer's disease. So Alzheimer's disease is benign dementia of Alzheimer's type, which is incurable, degenerative, and terminal disease. Slowly, the progressive disease of disease that is characterized by impairment of memory, eventually by disturbances in the instinct, planning, language, and perception, and the patient is not oriented to place, person, and time. What are the clinical cause? What are the guidelines for treatment? The clinical cause is at this moment we do not have treatment. Medications are used to help slow the progress of cell loss and cognitive impairment that is dementia. therapy is individualized more so that the quality of life. Now, we are talking about quality of life. We need to say that this patient is able to perform his daily tasks or daily activities without any assistance. The treatment, that is the treatment goal, potential benefits, adverse effects, cost, and comorbid condition and and if the pharmacotherapy is initiated, the benefit should be seen very simple. And it is considered successful if memory remains unchanged process. That means we are not talking about the memory that has already formed. We are talking about no new loss of memory. What are the treatment options that we have? The treatment options that we have are namely antagonist, the combination elements, and the medication. So let's talk about them one by one. And the major treatment that we are at this point, we are trying to do in acetylcholine is inhibitors. Now, these acetylcholine inhibitors by default inhibit the enzyme phosphorylation state possible for breakdown of acetylcholine. So acetylcholine stays there in the synaptic junction for a longer duration of time, and once it stays there for a longer duration of time, that means it is available for binding to the post-synaptic center in the function. So these are drugs that prevent the breakdown of the child, and this is involving them in other functions, but in the cell, increased coordination. We increase the various drugs that are approved by the heart, traumatism, vitamin, and the. So all these drugs are approved for mild to moderate Alzheimer's disease, and then you have the patches of traumatization and people severely which have been of severity. The most common side effects are gastrointestinal, and they are in pneumonia, vomiting, diarrhea, and side effects may become more tolerable over 2 weeks, and this is tolerable low gradation and the person administer with start with a low dose gradually. Then we have the NMDA, that is memantine. Memantine is another drug that is an antagonist. NMDA is a receptor. So what it does is it combines the receptor. So to decrease the negative effect of too much, increase inflammatory, keep the cells. So this particular memantine appears to be. Then there are various other medicines that are used, but there is lack of evidence for hospital that has been indicated. So they are discouraged, and again, we have some of the drugs that are being exterior use therapy, vitamin E, especially vitamin alpha cholesterol, celebrity, anti-inflammatory drugs is by far. But by far, the drugs that are most commonly used are acetylcholine inhibitor, and within a few of them we have either ranitidine, levostipine, or galantamine that can be used for the treatment of Alzheimer's disease. So this is basically a brief guideline or a brief summary into a brief presentation into the various neurodegenerative disorders and the drugs that are responsible that will be used in this particular situation. So I hope I have been able to give you some insight about the website. And if there are any queries, write in chat box, get back to me. Thank you for your patience. Have a great day and happy life. Thank you so much.